Okay, joining me on the phone is Dr. Donald Hopkins. Dr. Hopkins is the Vice President for Health Programs at the Carter Center in Atlanta. Good afternoon, Dr. Hopkins, and how are you today?
Good afternoon. I'm doing just fine. Thank you.
Great. I'm so thrilled to have you here on the show. Let's start out with the most recent news coming out of the Carter Center, and that's the news for last month. The big news was the announcement of the elimination of the parasitic disease River Blindness in Colombia, down in South America. First, can you briefly describe what River Blindness is? And two, why is the Colombia story so important?
River blindness is a parasite. It's a small worm that people get by being bitten hundreds or thousands of times by a small black fly. Over the years, several months and years, the parasites they mature in the body and release over several years immature parasites that get in the skin and ultimately in the eye, and over many years can cause blindness. Since the late 1980s, the drug company Merck has donated a drug which can kill the immature forms of this worm, but has to be given for several years, more than 10 years, in order to allow time for the adult worms to die. The story out of Colombia was very important because back in the very early 1990s, the 6 countries of the Americas that were affected by river blindness, those being Mexico, Guatemala, Colombia, Ecuador, Brazil, and Venezuela, all agreed to begin working to eliminate the disease from the Western Hemisphere. There were about 500,000 people then that were at risk of the disease. And Colombia is now has just become the first one of those 6 countries to eliminate the disease nationwide. And it is therefore the first country globally to eliminate river blindness throughout the entire country.
Oh, fantastic. And the other countries in South America, they are making progress in the same direction?
The other countries in South America are doing very well as well. In fact, we believe that all of the other countries have interrupted transmission in all of their foci, except for a small area in the common border area between Brazil and Venezuela. There's a very small focus down there among the Yanomami Indians in the remote forested jungle area where the treatment so far has not yet interrupted transmission. There were a total of 13 foci throughout those 6 countries, and we believe now that transmission has been halted in 11 of those 13 foci.
Outstanding. So what is the process that a country must go through to receive WHO verification of the elimination of river blindness or any other infectious disease for that matter?
Once a country believes that they have stopped transmission of the parasite, and they seek to document that by doing blood tests and by looking for evidence of the parasite in the skin of people and in nodules, and also by testing insects. Once countries believe they have interrupted transmission, they are required by the World Health Organization then to stop all mass treatments and continue monitoring people to see if the disease comes back. If they stop all treatments, monitor the disease, and there's no evidence after 3 years that the disease has come back, then the World Health Organization is willing to consider their documentation and decide whether it agrees that they have stopped the disease altogether or not.
Okay. And onchocerciasis remains a big issue in many parts of Africa also. What are the keys to achieving the same success as demonstrated in Colombia?
There are a few important differences between onchocerciasis, river blindness in Africa and in the Americas. In the Americas, the disease was imported with African slaves many years ago, and it is not as entrenched as it is in Africa. In fact, more than 99% of all the disease in the world is in Africa, with a tiny focus in Yemen as well. But in Africa, the disease is much better adapted. Many more people, in fact, World Health Organization estimates that more than 30 million people are likely to be at risk of this disease in Africa, as compared to 500,000 people at risk in the Americas. And the one difference also is that in the Americas, people were treated with the drug twice per year. In most areas of Africa that have started treatments for river blindness, they've only been treating once per year. But the Carter Center has been helping now in Sudan and in Uganda, and beginning to help in Nigeria and Ethiopia as well, to, by means of twice per year treatment, help to move those countries along the way to eliminating the disease nationally. The government of Uganda was the first in about 2007, if I remember correctly, to establish as a national policy that they intended to get rid of that disease nationwide, the first country in Africa to make such a declaration.
Okay, great. Let me switch gears a little bit here. The Carter Center and its partners are also on the brink of a landmark event, hopefully in the near future, and that's the elimination of guinea worm disease. And the story behind the guinea worm disease is really pretty astounding. The eradication campaign started in 1986, and there was about 3.5 million cases, mostly in Africa. Where do we stand today?
We're very close to eradication now. In 1986, when the first estimates were made of in recent times of the global prevalence of the disease, there were an estimated 3.5 million cases, and that was occurring in 20 countries. That same geographic area now is 21 countries, with the division of Sudan, the former Sudan, into Sudan and South Sudan. So we've gone from, in essence, 21 countries, 3.5 million cases now, to 4 countries. With in 2012, there were a total of only 542 cases remaining globally, and more than 95% of all those cases in 2012 were in South Sudan. The other countries were Ethiopia, Mali, and Chad, each of which had 10 cases or fewer. So most cases in 2012 were in South Sudan. And so far, in the first half of 2013, South Sudan has reduced its cases by another 81% compared to the cases it had in 2012. So we're getting very, very close to seeing the end of this disease.
All right. Just for our listeners who may not know what guinea worm disease is, can you just briefly describe what that is?
Guinea worm disease is another parasite. It's characterized by worms that are thin like a strand of spaghetti, pale white, and the worms emerge directly through the skin, very slowly and very painfully. This is an ancient disease dating from at least ancient Egypt. It is believed that the ancient practice of wrapping this emerging worm slowly around a stick over several weeks was the inspiration for the staff of Asclepius, the caduceus, the symbol of medicine. But when the worm emerges from the skin, it is seeking to eject hundreds of thousands of immature worms into surface water sources, such as stagnant water in ponds. When people drink water from stagnant water sources, such as open ponds or in Asia, step wells, they contract this infection, but they don't know they're infected until a year later, when, without any previous symptoms, these 2 to 3 foot long worms begin to emerge painfully and slowly directly through the skin. And they are incapacitating temporarily, causing people not to be able to go to school. Children, farmers can't farm. People can't do all the things that they need to do to support themselves and their children. So although it didn't often kill people, it created havoc in rural communities by suppressing agricultural productivity and people's ability to go to school.
Okay, great. And when do you think we'll be able to put guinea worm disease in the same exclusive category as smallpox?
I think we're going to be there within another 2 years maximum. Now, the way things are going.
Well, that's fantastic news. Dr. Hopkins, let's move a little bit closer to home. And the Carter Center is doing quite a bit of work down in Haiti and the Dominican Republic. Can you elaborate on that?
Yes. We also have headquartered at the Carter Center. The International Task Force for Disease Eradication began in 1992. I chair it now. And in 2006, this is a group of a dozen international experts that meet once or twice per year to consider diseases, whether we think they can be eradicated or whether we can get better control of them. And in 2006, the task force declared that in our considered judgment that malaria and lymphatic filariasis, both of them being mosquito-borne diseases, could be eliminated from the island of Hispaniola, that being the two countries of Dominican Republic and Haiti. Lymphatic filariasis is another worm infection that people get by being bitten by mosquitoes many times over the years. And in this instance, it causes massive swelling of the legs, arms, breasts, genitals in men, just a terrible disease. But there are two ways to prevent it and treat it. One is prevent it by keeping people from being bitten by mosquitoes of the type that transmit this infection. And the other is to administer certain drugs by mouth annually or twice a year to keep the infection from the immature worms from maturing in people. But the fact is that the island of Hispaniola is the only island in the Caribbean that still has malaria. Most of the other islands used to have malaria, but they've gotten rid of it.
Right.
And that island also has more than 90% of all the lymphatic filariasis in the Western Hemisphere. And so we just felt very strongly that it would be good for people's health, good for the economy of the countries, because, for example, in an outbreak in about 2004 on that island of malaria, it was estimated that the cost to the economy of the Dominican Republic alone, that one malaria outbreak, was about $200 million, because the Pan American Health Organization, the Centers for Disease Control, tourist agencies, and others were advising people not to go to Dominican Republic because of the outbreak of malaria. That island has also exported malaria to other countries, to Jamaica and to the Bahamas in some instances, as well as regularly exporting malaria to the United States. People with malaria. They haven't established new endemic outbreaks in those countries, but it's a nuisance, and again, it impacts on the tourism of those countries as well. In Africa, the same mosquitoes transmits malaria and lymphatic filariasis. The mosquitoes are two different mosquitoes on the island of Hispaniola. But the fact is that with mass drug treatment and use of bed nets, that island can do what the other islands in the Caribbean have done already, and that is to get rid of malaria in all of those other islands and get rid of lymphatic filariasis that affected some of those other islands as well. It would be good for people's health, and it would be good for their economy as well. And,
okay,
and we
wonderful.
Estimated in 2009, the two countries estimated that it would cost about $150 million to get rid of malaria over a 10-year period, which is already less than the amount estimated to get rid of, the amount cost estimated with that one outbreak of malaria in the Dominican Republic alone in 2004.
Okay, and since we're getting short on time, Dr. Hopkins, can you just briefly go over any other health initiatives that you and your staff are working on?
The Carter Center, we're working on several other problems in the Americas. We're also working on the problem of stigma with in association with mental illness. This has been a project of Mrs. Carter since before she went to the White House, in fact. And we've had for many years now brought in a half dozen or more journalists each year to help educate them, familiarize them with the problem of stigma and associated with mental illness, so that they then subsequently have written books, done stories on in newspapers, television, or radio, to educate people about the fact that, in fact, most mental illnesses are treatable, just are many physical illnesses as well. So that's one thing we're working on. We also have a big program on trachoma, where we're working in several countries in Africa. That's a bacterial disease that people get by contaminated fingers or by flies that pass this bacterium to the eyes, and over time it causes scarring of the eyelids so that the eyelashes rub against the eyeball and abrade it, and people eventually can go blind with that. There again, we have a donated drug, Zithromax, donated by Pfizer, that is given free in mass administration to publics that are affected, as well as health education and advocating for safe water so people can keep their faces clean. And that also has been a big program. In that, we've worked, as well as with River Blindness, in association with Lions Clubs International. We have many other donors as well. But Ethiopia and South Sudan turn out to be probably the two most severely affected countries with trachoma in the world. We're working in both of those, and the Ethiopians are making great strides against this disease, having constructed more than 1 million latrines. It turns out that the flies that transmit trachoma breed preferentially in human feces that's deposited on the open ground. And so if you can persuade people to use latrines, the flies can't breed there, and they therefore can't on around to transmit the bacterium that causes trachoma. So that's been another intervention. And of course, by educating people to build and use latrines, you're preventing many other viral diseases and some other infections as well, which is another important behavioral change and additional proof that people will act if they're persuaded it's in their interest to do so.
Very good. Well, the work that you and your team have done is really remarkable, and the dedication to eliminating these neglected tropical diseases by former President and Mrs. Carter is to be commended. I've been talking to Dr. Donald Hopkins, Vice President of Health Programs at the Carter Center. Thank you, sir, for your time and expertise, and keep up the good work.
Thank you very much.
All right. Bye-bye.
Goodbye.